Hello, everyone. My name is Zoe Masmanian, and I'm a project coordinator at Health Insight Nevada. Welcome to the follow-up to the blood pressure guidance webinar we had in April. If you aren't able to join us in April, no worries. We will recap. But before we go on, let's go through some quick housekeeping slides. So I want to draw your attention. So this is a screen you should see or something similar on your screen. I want to draw your attention to the bottom of the screen towards the viewer functions. So you have several, you're currently on mute, but you have several ways of communicating here with us. So you can either use the chat function, and everyone will be able to see that when you chat, or you can use the raise hand function, and we can always promote you for any questions that you have. Or if you'd like, you also have the option of using the Q&A. So you can pose those questions to any of the panelists today, and we'll answer your questions there. If you're going to use chat, just to let you know, you can either, again, pose your questions to everyone, but you also have the option to choose to just speak to the hosts or the panelists here as well. So I'm going to hand it over to Rebecca. Go ahead, Rebecca.
Yeah, thanks again for joining. For those of you on the webinar, I have my camera on, so this is me. I do see we have a couple people just on the phone, maybe, and so that works too. We are Health Insight. Some of you may already be familiar with us, but if not, we are the Quality Innovation, Quality Improvement Organization. We're in 4 states, Oregon, Nevada, Utah, and New Mexico. And we promote the CMS quality strategy, which is to eliminate disparities, strengthen infrastructure and data systems, enable innovation, and foster learning organizations. And we've got a small enough group here today that we would really like, if you're willing and able, to speak up and let us know who you are and what kind of setting you work in. That will help us a little bit too in the conversation, so that we can tailor things to you a little bit more. Lily has taken you all off of mute, so you're kind of in charge of yourselves now. You can find the mute function on your screen. Sometimes you have to hover over the bottom of your screen to get that toolbar to pop up where you can see your mute function. But she's taken you all off mute, and I'm hoping that we can kind of go around and introduce ourselves. We'll start with Health Insight, folks, so I'll give you a minute to think about that. We'll start in Oregon with Rebecca Bally.
Hi there, I'm Rebecca Bally, and I am a project manager and practice facilitator here. I support our Medicare cardiovascular health initiatives, and I also support clinics on a number of other quality improvement issues. So, hello.
And I'll also say, Lily, that it looks like some people's cameras have turned on. We would love to see your face if you're willing to let us see you and let us know who you are, but you also have the ability to turn off your video. Same way, it's usually right by your mute button if you want to turn that off. So totally up to you. But like I said, we like to see who we're talking to. All right, Edie in New Mexico.
Hi, Edie Taylor, Health Insight New Mexico. I'm a project manager. I also work not only in the cardiac task, but as well as diabetes and behavioral health.
Fantastic. And you met Lily already at the start of the call, and she works in our Nevada office. So that's us. Welcome again to the call. So maybe to make this a little bit easier, I'll just go by state and ask for volunteers. And if I don't hear any volunteers, then I may just start calling your name off the participant list. But you, of course, always have the option to tell me that you'd like to pass. No, thank you. You don't want to speak up, or you're welcome to chat in your answer as well. So how about about anybody else here in Utah with me on the call today? Am I all alone in Utah? I guess so. Okay, how about Nevada? Anybody else in Nevada today? Maybe everybody's just feeling shy. How about Oregon?
This is Akira Templeton from the Oregon Primary Care Association.
Oh, fantastic. So what role do you play there?
I am Quality Initiative Specialist.
Great.
30
Excellent.
centers on
Then
a
this
variety of-
this webinar hopefully will speak right to you today then.
We're doing a webinar next week on hypertension, so
Okay,
good updates.
great. Great. Anybody else in Oregon?
And I'm not in Oregon, but this is Lisa Sharrett, the Heart Disease and Stroke Prevention Coordinator
Great.
from the state of Nevada.
Excellent. Thank you. And do you work with Health Insight already?
Yes, we do.
Great. Good. So you have some familiarity with us. How about New Mexico? Anybody in New Mexico? Okay, well, I know we have more people on the line than have spoken up, and that's okay if you don't if you don't want to speak out. But anybody that I missed that would like to introduce themselves? Okay. Well, thanks for playing along. I mean, a lot of the value that people get out of these phone calls is sort of knowing who else is on the line and really coordinating and networking together, because you all have fantastic ideas of things that you're doing in your settings. And so the ability to be able to share those things with each other really is valuable. So we'll get into the objectives here now about what we hope to accomplish on today's call, which is some recap from last month, although it seems like a lot of you may be newer. If you want to chat in whether you attended last month's webinar, that'll help me to know kind of how much to cover here. But we hope that by the end you'll understand some of the blood pressure categories out there, how to attain an accurate blood pressure measurement, some external factors that affect blood pressure, and training materials that are available. The training materials, that's kind of a new thing that we'll be adding today based on feedback that we got after last month's webinar. So to the categories. Some new categories came out last year, at the end of last year in November. If Lily, you want to go to the next slide, we can look at some of what was new. This puts the category of high blood pressure into a lower range than it was previously. So now 130 to 140 over 80 to 90 is considered high blood pressure. Now that certainly is going to increase the number of people in the United States who are categorized as having high blood pressure. And if we go to the next slide, you can see that up until this point, JNC7 were the guidelines that most people were following and may still be following, which is hypertension is 140 over 90. There is some controversy still as to whether people want to accept these new guidelines or not, and so that's why I wanted to show both of these to you side by side, and to just reiterate that although there are new guidelines out, they've not been fully adopted by all medical societies yet. So I would be interested to know, if you're willing to tell us either through chat or to speak up, has anybody had the conversation in their setting yet about which guidelines they're going to follow? And maybe Akira, as you're putting together a presentation, maybe you have some insight into what you guys are thinking there, but I'd be curious to know, has anybody had those conversations yet?
Well, we're still following the 2017 UDS definition, which is still 140 over 90.
Okay.
I plan on just mentioning the updates. Most health centers are probably aware of it already, but I plan on just mentioning it. But right now, we're still using the 140 over 90 per UDS.
Okay. Anybody else? And that's a little bit what we've, at least in Utah, Health Insight Utah, and the coalition that we work with here on a lot of Million Hearts and blood pressure work, we have decided that, you know, we're going to continue to show that both of these guidelines exist. Because we haven't heard, you know, which direction people are going. And as we are contractors to CMS, we haven't heard whether Medicare is leaning one way or another yet either. So I think a lot of people at this point in time, until the dust settles a little more, are sticking with that 140/90 as the blood pressure category that they're following. But whether you're using old guidelines or new guidelines doesn't really matter, as you'll see on the next slide, according to our medical director here in Utah, who is a family practice physician. She feels that if a provider feels the blood pressure is accurate, then they're more willing and proactive about treating hypertension. And really, at the end of the day, that's what we're hoping, is that we're helping our patients by getting that under control. And so part of that, a big part of that, is measuring accurately. So we'll get into some of that. Placement is a really big part of that. And if the patient needs to be in a comfortable position with their back supported, feet on the floor, and you can see here what it does to the blood pressure if that doesn't happen. It really could raise their pressure. Patients' legs need to be uncrossed, again, can raise the pressure. And they should be allowed to rest for 3 to 5 minutes before obtaining a blood pressure. Now, we found in some of our work that that is a really tough thing, and that's one thing we work with a lot of clinics, is helping in that workflow to build that in, because everybody gets so rushed and behind that it's sometimes hard to allow patients that time to rest for 3 to 5 minutes. But doing that can really has been proven to help. And all of these are based on best practices that have been seen and studied and researched over across the country. All right, the next is cuff sizing. Very important to make sure that the appropriate cuff size is used, and that is another thing that can affect the pressure. So hopefully in your settings, those cuff sizes are available to all of you. Next is how you actually take the measurement. Placing the cuff on the patient's bare arm. Any idea what that might do? If you advance again, Lily, it should show us what it will do to blood pressure. Depending on the material of clothing, it can make it very inaccurate if it is not on a bare arm. Again, if patients are speaking to you, which is really, again, a hard thing to do. I think people have the tendency to want to fill that silence, and so we chat. But if a patient is speaking while having their blood pressure taken, the systolic pressure could increase by 10 to 15 millimeters mercury. And of course, where possible, every attempt should be made to obtain the blood pressure on the patient's left arm with the arm supported at the level of the heart. Again, can have some effect on the blood pressure that way. So even though these may seem like all very little things in the positioning of the patient and the taking of the measurement, they really can add up to a false reading. On the next slide, we've got just some examples of other things that can affect blood pressure and increase how that works. Some of this may be things, full bladder, that's another thing that can be worked into the workflow in some instances, something we maybe don't really think about before we're rooming patients. So that could be another area to focus on. So before we move on, this is sort of the last slide I have as a recap of what we talked about last time. Does anybody have any questions about any of that content? So as I mentioned, one of the things that came out of that, we received some requests and email follow-up after the last webinar, was people wondering about training and training materials on some of these things. So we've added some of that information this month, and I'm going to let Rebecca Bally in our Oregon office go over some of that for you. And feel free to continue to chat in some questions as we go along, and we'll get to them at the end.
Great. Yeah, thank you, Rebecca. And please do continue to chat in your questions. And we did get a question about whether this is being recorded. And yes, this is being recorded, and we'll post it to our website. I put the link in earlier, and that's also where you can find the recording to last month's webinar, where we went a little bit more in depth in some of the things that Rebecca just covered. So as Rebecca mentioned, we had some requests for training materials. So how do you train your staff on all these different factors, and how to take a blood pressure properly, and how to do it regularly? And so we've put together some of the resources that Health Insight has developed with our partners in the Utah Million Hearts Coalition, and also some resources that are available through the American Medical Association and the American Heart Association as well. And really sort of thought about a stepwise process for developing a staff training. And the first step that we wanted to emphasize was really getting staff and providers to acknowledge the importance of measuring blood pressure accurately, and not assuming that all your staff are on the same page about this, but really honing in on all the different things that can affect a blood pressure, like Rebecca just reviewed. And we do have some documents linked on our website that maybe Edie can chat in the link to some of our resources, but on the importance of measuring blood pressure accurately. And then step two, really sort of demonstrating your commitment to accurate blood pressure. So after you've acknowledged as a team that this is important, and you want to get it right so that you can better care for your patients and help them control their hypertension. Or even just acknowledging that, yes, we feel comfortable that this diagnosis is, or that this measurement is accurate, so we can make a diagnosis, is demonstrating your commitment. And you can do that in a couple of different ways. So as you'll see on the next slide, we have sort of a template for how you might develop an office policy around training. So acknowledging, yes, we're going to do this training once a year on this day, and these are the things that will be included in that training. So staff is prepared and aware, and it doesn't feel punitive in that they feel like you're not trusting their capabilities, but rather this is something that is standard. We're going to do it every year for everyone, and it's not to call out anyone because we think they're not doing it right. It's just to reinforce what we already know. And there's also some posters that the AMA, the American Medical Association, and the American Heart Association, the AHA, have put together on simple tips for getting accurate blood pressure. And we didn't put that in the slides, but those are available on, I think they're linked on our website. If not, you can find them on the AMA and AHA website as well. And that's a poster you could put up in the exam room that patients can interact with, and they can get involved that way if you're doing some patient education. And it also helps them understand, why are you doing it this way? Why are you asking me not to talk? And they can be involved and say, hey, aren't I supposed to be sitting in a chair with back support? And why are my feet dangling? And those kinds of things. Step three, really observe staff before the training. So see where there are some gaps. And you'll see a little bit later in the slides, we put a sample checklist for how to do some of those observations that you can walk through and observe your staff as they're taking blood pressures, and just note, what are some things that maybe are being missed, or that staff aren't doing according to evidence-based, and really trying to get at the bottom of why that is. And again, not punitive, but just cataloging that and seeing, is this something that all staff are forgetting to do, and is that something we should focus our training on, or is this just a onesie twosie, and why might that be? And then step four is to actually conduct the training. And so on the next slide, you'll see a link to a training video that we've shared before, and the link's also in the chat. There are lots of different training videos. This one is nice because you can see sort of the role play, and you can watch it together with a team, and they show you first sort of how not to do it, and then you can ask your staff, okay, what should the the staff have done differently in taking that blood pressure, and so it's kind of a fun way to talk about that. There's also several materials we have on our website about recommended techniques for measuring office blood pressure, where you can cite different references, resources. So this is one of them with again, just quick references. So how do all of these different common errors impact the blood pressure reading? And just so staff can have that in hand. And again, I would say in this conduct training phase is really focus on some of those gap areas that you identified during your observation period, and make sure that staff feel comfortable about this, and really let them get engaged. And I know we are working on developing some different training materials, slides, and sort of a facilitator's guide that we should be able to share in, I'm not sure when, but maybe a couple of months or so, but that's something that we'd be happy to share with you. There's also training curriculums available online, including the American Medical Association has a Steps Forward website, and they have a whole module where clinicians can get CEUs for completing, and it's on how to accurately measure blood pressure. So that's one. And then after the training, or I guess, sorry, one thing I did miss in the training I wanted to focus on is if there are specific common gaps that you see or errors that are being made in the blood pressure measurement technique, I think important in the training to really approach it from a aspect of, what's the barrier to doing this properly? Is it because, we don't have the appropriate cuff sizes in every exam room? Is it because we don't have a chair in the exam room or enough chairs in the exam rooms that if a patient's bringing their family member, we're seating the family member in that chair, and so putting the patient on the exam seat, and so their feet are dangling and they don't have back support. So just talking through some of those things with your staff to really figure out what can we address through our quality improvement and processes to really make sure that we're getting this right every time. And then fifth and final step, and on the next slide, you'll see that checklist I talked about, is to consider re-observing staff in 1 to 3 months to just see, did it stick, and talk about the pre and post scores, and work with staff on that, show them how they perform before and after, and let them be involved in it. And again, not in an accusatory way, but in a here's what some gaps were earlier. We talked about this in the training, and we knew that X, Y, and Z was a barrier, and we've tried to address that, and we're seeing either it's still happening, so what's going on, or we're seeing that you're doing it correctly now, and so we really appreciate you paying attention to that and really being involved in our commitment to accurately measuring blood pressure. So I think that was it for I wanted to keep it short and simple, a 5-step process to training staff. So I wanted to pause and ask for any questions. I was talking so fast. I'm wondering what the trainings look like in your, and Rebecca just put this in, are there training standards in your practice settings? What do those look like? Was this a helpful walkthrough? Is thinking about setting up a training for staff in this kind of 5-step process, is that a helpful way to think about it? We've got a shy group today.
Yeah, and I'm not sure what settings the other folks are in, and so maybe I don't know if it's as applicable to you or not, but that would help us to know. Yeah, I'd be curious whether it seems like when we go out into the clinics, which is a lot of where we do our work, is in physician office settings. is this is one of the things that we get asked about the most is, do you have some sort of kind of training package or training toolkit that we can use with our staff to make sure that everybody's taking measurements in the same way, that we have a standard, that we have consistent training, so that everybody's on the same page. And like I said at the kind of the beginning of my slides, so that the provider, whoever is making those management and treatment decisions, can feel comfortable in the measurement that was taken and that it was accurate, and feel comfortable moving forward with the numbers that have been recorded. So yeah, is this something useful? I think that is something we want to know. Is it useful for us to continue kind of putting together this type of package or toolkit or something like that for people to use? Is pulling these pieces together helpful? Might have to go with silence as acceptance on this one. But we've put a lot of the links to everything that we've talked about today in the chat. If you have access to that, you can find those links there. It's certainly not an exhaustive list. As Rebecca mentioned, you can find a number of tools on the National Million Hearts website, American Heart Association. Here in Utah, we have a very active Million Hearts Coalition that tries to develop things that we find as we hear needs in the community. Like I mentioned, some of these training standards and policies, that's where that came from, was just feedback that we've gotten from people. So we're always open to hear what you need to make your job easier and to be successful in what you do. So certainly let us know if you've heard something today or not heard something today that you'd like to hear or see.
Yeah, and I just wanted to remind folks, I know maybe you weren't prepared to be called on, I guess, in this setting. And so for our Learning in Action Network calls, we do them every month. We try to do a couplet. So the first one being a more formal webinar that you might be used to, where we bring in an expert and do a presentation, an actual presentation, and we usually fill the full hour on that. And then we try to follow up the next month with a more informal call. We do a little bit of a review, and then we're really trying to get input from attendees. Did you have follow-up questions? Were there things that we didn't cover that you wish we had covered, or that you think we should focus in on a future webinar? But just so you know, that's sort of the model that we're using. Is sort of 1 month is a full webinar, formal, 1 hour, and then the following month is sort of a recap and follow-up, a little more informal, more of a coaching round robin style. So you're prepared and don't feel caught off guard next time. And with that, I see Lily put in the slides, and maybe Edie can speak to this, because Edie will be coordinating the next month's webinar, and so this will be a webinar next month.
Yeah, I'm actually in the process of, we're gonna look at doing a walk with the doc presentation, something that is focused on, the beneficiary side and how we can engage our beneficiaries into heart healthy exercise, and maybe even looking at some heart healthy eating and recipes for next month.
Great, so we hope to see you there. You should see registration information come out in the next few weeks. So please be looking for that.
And remind me, Rebecca, of the process. So Edie or Lily, somebody in the chat has put in the link to past recordings. So you can always find this one today there as well. But we will send out the slides and a link to the recording in a follow-up email. Is that correct?
Correct.
Okay,
But we will not be posting the slides online like we have done in the past. We will only be emailing them.
that's correct. Okay, good. Well, we'll pause here for 20 seconds or so. If you have any questions that you want to take yourself off mute and ask us, or put them in the chat, we'll pause here for a little bit, give you time to do that. And then if in a little bit we don't say anything, then we may be able to wrap up today.
And I do want to offer that all of us are available by email as well. So if you think of a question later and you want to reach out, I'll put my email in the chat so you have that. And yeah. Or if you have ideas for future webinars, we're always welcoming them.
Thanks for putting that in there. Lily, do you want to wrap us up? I think we can go ahead and end early as I don't see any anything in the chat unless you've gotten anything in the question box.
No, nothing in the question box, and I don't see any questions in chat either. So